Hello, this is Zachary Peck speaking on behalf of our team, which includes Dr. Diamond Gathers and Dr. Eileen Barrett. Thank you for the opportunity to share with you on our work on evaluating the use of racial identifiers in case reports in a medical journal. The importance of our work is based on the fact that race is a social determinant of health, often because of racial biases existing both on an individual level among physicians as well as on a system-wide level in biased processes and practices. One strategy to narrow the gap in health inequities between racial groups is to avoid reifying racial differences as biological differences, as this practice can lead to reinforcement of previously held biases, and also attribute health inequities to biological differences rather than to the social and systemic root causes of inequality. In this project, we review case reports in a medical journal, with the hypothesis being that racial identifiers are often unnecessarily used in these case reports, especially when used to identify marginalized groups. We reviewed case reports in the Journal of Hospital Medicine, published from the years 2006 to 2018. 152 consecutive case reports were included in our analysis, and we reviewed these cases for specification of race or ethnicity. After we started the process of reviewing cases, we decided to go back and also record instances of potentially stigmatizing language present in the case reports. For example, terms connoting substance use and other stigmatized medical diagnoses such as obesity and treatment non-adherence. What we found was that approximately 1 in 5 case reports included specification of race. However, there was a disproportionate specification of Blacks and African Americans in case reports, who represented 35% of all cases where race was specified. The first graph shows the number of times race was specified for each given race, and shows that Blacks and African Americans were more likely to be specified than any other race. The graph below compares the likelihood of Blacks and African Americans being the specified race in cases where race was specified, compared to overall proportion of Blacks and African Americans in the general US population. While Blacks and African Americans make up 13% of the US population, they made up 35% of the patients in whom race was specified, which was a statistically significant difference. A secondary analysis was performed to compare rates of racial specification between cases where potentially stigmatizing language was used or was not used. And we found that in cases with stigmatizing language, race was significantly more likely to be specified than in cases without stigmatizing language. And this is shown in the third graph. The case reports reviewed in this study disproportionately identified Black and African American patients compared to other races, and race was more often mentioned concurrently with stigmatized medical diagnoses or behaviors. These findings suggest that case reports perpetuate bias and potentially worsen health inequities. Strategies for reducing this include robust peer review and providing prospective authors with guidance on avoiding the use of racial identifiers and stigmatizing language in their medical scholarship. Thank you.